Odd signs and symptoms of cancer are paraneoplastic syndromes, which are rare disorders with complex systemic clinical manifestations from hidden cancer causing changes in the immune system. In other words, cancer cells do not directly manifest symptoms of spreading. Instead, cancer cells generate different chemicals that affect multiple organ systems such as neurological, dermatological, gastrointestinal, endocrine, hematologic, and cardiovascular systems. Symptoms can manifest before or after the diagnosis of cancer. These odd signs commonly manifest in patients with lung cancer, breast cancer, hematological malignancies, medullary thyroid cancer, gynecological cancer, and prostate cancer. Cancer cells are immunogenic and lead to the activation of immune systems. It is noted that specific type of immune cells called cytotoxic T cells recognize antigens on cancer cells and attack those cells, or generate antibodies against the cancer cells. However, the body's immune system can attack normal tissue with a similar antigen presentation and lead to symptoms. Most cases exhibit this odd sign called paraneoplastic syndrome with immunologic mechanisms. However, there are non-immunologic mechanisms of paraneoplastic syndrome. Paraneoplastic syndromes may involve multiple organ systems with heterogeneous and complex clinical manifestations in the setting of a hidden cancer. Clinical presentations are categorized based on the organ system as follows. When the central nervous system is involved, patients may present with cognitive dysfunction, depression, personality changes, hallucinations, seizures, somnolence, autonomic dysfunction, and less common endocrine dysfunction if the hypothalamus is involved. It can cause subacute cerebellar degeneration. This is commonly associated with breast cancer, small cell lung cancer, Hodgkin lymphoma, and ovarian cancer, and clinically manifested as ataxia, dysarthria, dysphagia, diplopia, dizziness, nausea, and vomiting. Opsoclonus myoclonus syndrome, clinically characterized by uncontrolled rapid eye movement, body jerks, ataxia, hypotonia, irritability, and commonly affects children less than 4 years. Opsoclonus is the common manifestation in children, whereas ataxia is more prominent in adults. When the neuromuscular junction is involved, patients may present with myasthenia gravis, which is most commonly seen in patients with thymoma and is clinically manifested as a weakness of voluntary muscles and diaphragmatic weakness. Lambert-Eaton myasthenic syndrome, which is strongly associated with small cell lung cancer. It is characterized by weakness of the proximal muscles predominantly affecting thigh and pelvic muscles. Patients generally have difficulty in strenuous activity. Moreover, patients also have difficulties in basic activities such as climbing stairs, walking, and getting up from a chair. Symptoms are gradual in onset with slow progression. They may also have dry mouth, decreased sweating, and constipation. When the peripheral nervous system is involved, patients may present with dry mouth, dry eyes, altered pupillary reflexes, bladder or bowel dysfunction, and orthostatic hypotension, constipation, nausea, vomiting, dysphagia, and abdominal distension. Subacute sensory neuropathy is characterized by paresthesias, neuropathic pain, decreased sensation, and diminished deep tendon reflexes. It affects both the upper and the lower extremities. Distribution can be either multifocal, asymmetric, or symmetric.